I'm Dr. Mark Khorsandi. Welcome to the Migraine Relief Center. I started the Migraine Relief Center 2 years ago because I felt that a lot of patients were feeling neglected and not getting the attention they need for their migraines. What excites me about this clinic is that we are making a significant impact. The patients that we are treating are getting better. These are patients that no longer need medications. They have returned to work. They have returned to their families. They are performing the activities of daily living that they wanted to. And the proof of what we do is in the patients. They're getting better. They're getting relief. And that excites me. That makes me feel good that I know that I've made a significant impact on their lives. In a few moments, I would like to share with you stories of patients that I have treated at this clinic. These are real patients, real lives, real stories.
I've been dealing with the migraines for about 7 years, and I have taken almost every medication on the market for migraines, and then all the alternative therapies. I've done herbs and vitamins and homeopathic medications. I've taken medications that's given to horses for inflammation, every prescription antidepressant, anti-neuroleptic, anti-seizure medication, you name it, I've taken it. The past couple of years, when the migraines became almost daily, my life basically ended. I didn't go anywhere, I didn't do anything. I spent most of my time in bed. My children would come home from school, daycare, every day, and they would say, sorry. They were 4 and 5, and they would ask, "Mom, do you have a headache today?" And they would be whispering, and that became an everyday event for them, which made me feel terrible. But the light bothered me, the sound bothered me, everything, and I was in pain constantly. So I didn't have much choice but to stay in the bedroom in the dark, and my husband had to basically do everything.
There'd just be times is she ever gonna get any better?
I was in a big depression. I didn't see an end in sight. I thought my life was over, basically. What is kind of eye-opening is the fact that I'm a nurse and I'm very knowledgeable in the medical field, and it still took me time to find this procedure. I found the Migraine Relief Center because I was searching on the internet for anything and everything to try to fix my migraines. The type of personality and the compassion that Dr. Khorsandi has for patients is like none other I've ever seen, and I've been in the medical field for a long time. And that was amazing. And right then I knew that, he was the one that I wanted to take care of me.
The surgery just, I don't believe in miracles. It was a miracle.
By the time I woke up, I already had 2 black eyes and my face was swollen, but I was smiling from ear to ear because I went in the surgery with a migraine and I came out without one. And that was amazing. Now, the difference in what I can do. It wasn't even a week after the surgery, and I was up, and we were running and playing, and I still had staples in my head. We were going to birthday parties, and I felt wonderful, and wanted to take my kids to do everything that I could. I was trying to make up for lost time.
The biggest deal is I got my wife back.
Dr. K saved my life, because my life was over. That's how I saw it.
Yep.
A lot of patients that have the surgery pretty much notice a difference almost immediately. Same day, they can feel some kind of relief.
I was very stressed out. I was going through a very stressful time in my life. That's when I started getting some headaches Then they developed into migraines and eventually into a complex migraine. All of my family members were affected. It affected my children. They were sad and depressed by seeing me having these severe migraines where I couldn't basically move nor stand up and do things for myself. And it also affected my marriage so much that after just 3 months of marriage, my husband decided that he couldn't be with me anymore. So he filed for divorce. I guess he thought my seizures and this stage in my life were permanent and that I had no cure. He didn't want to be stuck with me. It's basically what it is. When you are experiencing the kind of pain that I was in and trying to describe it to people, many of them just wouldn't understand. Or I think that to some extent they would think I was, making it up. But when I went to Dr. Khorsandi, he was able to immediately pinpoint my problem areas. And as soon as he saw me, he said, "Does it hurt here? Does it hurt here?" And I cried because I'm like, oh my God, somebody understands. After seeking so much advice and help and treatments, I was skeptical and I didn't think that the results would be so dramatic, but they have been. They have been life-altering, life-changing. I mean, immediately after the surgery, I felt some relief. A couple of days later, I was practically back to normal. I'm still under recovery, but my son did actually say, "Mom, you're doing much better. That's awesome." And they also mentioned that my scars, you could barely tell. So that's another big thing. The cost of the surgery is, when you compare it to everything you gain back, it's relatively small. It's priceless to me in reality. And I would do it again in a heartbeat.
The surgical procedures that we perform are life-changing. They have made a significant improvement in many patients' lives. The MISON procedure stands for Minimally Invasive Supraorbital Nerve Decompression. It is a minimally invasive procedure, meaning that the incisions are very small. They're placed within the hairline, and the surgery is performed through those tiny incisions. Our goal is to provide migraine relief with decompression of the nerves. For patients suffering with occipital neuralgia, we perform the Migraine procedure. This is minimally invasive greater occipital nerve decompressions. The procedure takes less than 1 hour to perform and is done through a very tiny incision in the back of the head. For patients suffering with temporal headaches, we typically make a tiny incision right around the temporal area, identify the tight tissue that's causing compression on the nerve, release that tissue, and make sure that nothing else is putting pressure on it. The surgeons at the Migraine Relief Center have one goal in mind: to get you through the surgery safely and to get the best possible outcome for you.
I was experiencing migraine headaches on a daily basis, every day, all day. Dealing with a migraine headache, you can't do anything. It would cause me to be reclusive to the point to where I didn't want to get out of bed because I really couldn't. I couldn't digest food because I was so nauseous. It was just debilitating. That's just about it, really and truly. I had been taking medicine after medicine after medicine, and it was just a temporary relief. I wanted something for the long haul. I had the surgery March 4th, 2013, and after I got out the surgery, I have had maybe one headache. One. That's it. It did wonders. I have my life back. I have my life back. I can plan things now and go forward with them. I can be with my family. I can be with my friends. And that's it.
I understand a lot of patients can be apprehensive about having a surgical procedure, particularly for migraine headaches. Rest assured that this is an outpatient surgical procedure with minimally invasive incisions.
We came in here to try to get some help for Jacob. He's been having migraine headaches for a long time, and it's gotten to a place where he was having multiple headaches a week and missing a lot of school. We tried a lot of other things to try to help Jacob out, but it wasn't working for him. He was getting worse instead of better.
Well, he spent many nights just curled up with a pillow in the bathroom because of his migraines.
So he was afraid he was going to be nauseous. He would try to stay in the bathroom and even sleep there sometimes because of that. We were very glad that Dr. Khorsandi agreed to see Jacob because we had been so many different places and done so many different things already. It was I don't want to say it was the last straw, but really we were getting to where we were running out of options of things that we could do. So we were very hopeful that Dr. Khorsandi would be able to offer something that would actually produce some positive results for Jacob.
Surgery makes everybody nervous, but it went really smoothly and quickly, and he recovered pretty quickly.
He has not had a migraine headache since the surgery, and I guess the pain that he experienced, he didn't describe being any worse than the headaches had been.
Did you notice a difference after the surgery?
That I wasn't having bad headaches anymore.
Did other people notice it around you?
Yes, they did.
It was just awesome to not, to take him to school and not get a call from the nurse an hour or two later. It's just amazing. It's great.
I've been concerned, and I know Susan has too, about the number of drugs that Jacob's been taking. It's great to have him off of all that. What did your teacher say to you?
They told my mom that I was like a whole different person.
When patients come in, if they haven't been treated with some type of injection, we feel that a steroid injection or a Botox injection can be diagnostic and therapeutic. What I mean by that is if we inject into that area where we believe the muscle is causing compression of the nerve and the patient gets relief, either short-term or long-term, that gives us a pretty clear indication and sign that it's that muscle that's involved with that nerve causing migraines in that location.
For these 16 years, I've had off and on headaches. And then, 10 months ago, in the middle of July 2012, they started every day, all day. And it was just unimaginable pain. And after 4 months and going to all these doctors, and then the first neurologist dropping my case, I lost all hope. And every day I'd wake up just feeling that pain again, and I hung myself because the pain was so bad. I had no idea how bad my thought process was. All you think about every day is just making the pain stop. And on the way up here, she told me that he was going to be doing Botox injections, and I was like, you gotta be kidding me, I'm not getting no Botox injections, that's stupid. But as soon as I got those injections, like immediately, I started to feel relief. I was totally dumbfounded because it had been so long since I had any kind of relief. And we talked to Dr. Khorsandi, and he's like, let's do the surgery. He goes, I really can help you. And it was the most awesome thing. Like when I woke up from surgery, that just pain that had been killing me for 8 months was like gone, man. And I've been recovering over these past couple of months, and I'm doing things again. I find myself smiling for odd reasons every once in a while. I'm being a part of stuff again. When you're having these headaches, your body, it no longer becomes the vessel that you're traveling through life. It becomes your prison, and you're just enslaved to this pain. And all you want is this pain to go away. And man, I'm so happy because, you know, this surgery has helped me and my pain's going away. You know, it's awesome. I just want more people to know about this. That some people, they, like me, you know, you end up getting hopeless and thinking there is no help. And I don't want nobody to go through the stuff that I went through.
Patients that I see have probably gone to several doctors, some neurologists. They've tried multiple classes of medications, and they have just not gotten relief.
We're ready tomorrow for surgery.
Yes.
Okay, excited?
You know, I am. I'm very excited. I'm very hopeful. I see a light at the end of the tunnel again, and it's yeah, it's exciting.
And it's been nonstop for you, right?
It has. I mean, I think there's been a few days where it's not as bad, but for the most part, every day, all the time. I will wake up in the morning, and it's not a question of do you have a headache or do you not have a headache. It's a question of, yes, I have a headache. Of course I have a headache. How bad is it? How functional am I going to be? Am I going to throw up, or am I going to lay in bed?
And what's a good day for you?
A good day is usually when I don't puke or cry. You know, that's a good day. I'm going to put it this way. I think a lot of us with migraine disease, we personalize it.
Right.
Like I don't want to say it's my friend, but it's another personality. So my migraine monster has 4 heads. Mm-hmm. The first is ice picks in my eyes. And right now I have ice picks that are pointing this way, and this way, right behind my eyes. And then I have the vice grip, and that's in my temples, where someone's just tightening it down, right here. And then the third head on my migraine monster is in the back, right at the base of my skull, and it's just being squeezed, just like somebody's stepping on it and grinding their heel into the back of my head. Right. And then the fourth head on my migraine monster is a pressure headache. And the way I describe it is when you're in an airplane and your ears plug up, it's like that, only it never goes away.
Do you remember any of the medications that you've been on?
At first I was really afraid to take the pain meds because you always hear about how people get hooked on prescription drugs. Right. And I think my husband can tell you that when we first met, I was in a lot of pain. Only I wouldn't take my meds because I knew they were narcotic and I didn't want to get hooked on them. Right. I just met the man of my dreams. He's going to think I'm a drug addict, you know, so it started out with those. And then when those kind of stopped working or started to mess with my stomach, then came the antidepressants. Then came the anti-seizure medicine. Muscle relaxants, those knocked me out. Sleeping medication. There's stuff in my medicine cabinet that I think, oh my gosh, it would be so easy to accidentally mix them up. Yeah. None of them really work. All of them had weird side effects that were scary. And you just, as a patient, you don't really know what are my limits.
You were very active in work beforehand. You have a high-stress job before you really started having migraines.
Yes. I've got a master's degree in test engineering. I was working for a gaming company here in town, and I was running a lab. I had 21 people who reported to me, and it finally got to the point where I couldn't work. I lost my job over this disease. I couldn't keep up with it. And yeah, I had to leave my career, and that's been very hard.
Very sorry about that.
I mean, my whole life, I work. I didn't have kids. I wanted a career instead. And I poured my heart and soul into everything that I did, and then when that's taken away from you, it makes you feel horrible, like you're lazy or you're stupid, and it didn't help with the stigma of this disease.
months ago. You still have some activation, which means that... Okay. Let's take a look.
Like right there, right there. I'm 50 years old and I finally met this guy and he's awesome and he's been such a blessing in my life. But at the same time, I feel like I'm not good enough for him because I'm defective. And I want to be able to do so much and we just can't.
The success we're seeing with the surgery is very encouraging, it's very satisfying, and it makes you believe that we can really change people's lives. Right there? Start dissecting on my side, I'm going to start dissecting on this side. Anything with a spreading surface? No? Good.
Let me make a suggestion. Maybe we'll go lateral.
Look how tight that is. Oh, it's banding around it.
We found serious points of compression, occipital, frontal, temporal.
It just, once we freed it up, the nerve looked just, it's hard to even describe it, the nerve looked happier.
Absolutely.
I think Anna's going to do quite well.
I'm really excited too. I think she's going to do very well.
Yeah. Her life's going to be changed. All right, Anna, we're all done. I'm going to head to recovery.
Today you've taken a very important step in your life to ending your migraines. You've heard from my patients. These are real migraine sufferers. Give us a call. We look forward to taking care of you.